Hello, fellow HIM 5301 students. My name is Sean Weber, and I will be presenting on an article entitled The Value of Healthcare Information Exchange and Interoperability, written by Walker, Johnson, Adler-Milstein, and Bates. Overview of the presentation. I will start with an introduction, then go into definitions, followed by study data and methods, then results, then elements needed for nationwide interoperability, and I will conclude with a summary. Introduction. Healthcare Information Exchange and Interoperability, HIEI, has potential to yield a net value of $77.8 billion per year once fully implemented and standardized. That figure is based on Level 4 adoption and is a nationwide projection. Before I get into definitions, I want to give a little bit of the article's context. The article's main emphasis was to show the benefits of interoperability. The authors conducted the study through conducting literature reviews, interviewing experts, and developed an analytical framework to describe how healthcare entities can share information. This taxonomy consists of Level 1 to Level 4, with Level 1 being the lowest and Level 4 being the highest. Level 1 is non-electronic data. This is no use of information technology to share information. Level 2 is machine transportable data. This is transmission of non-standardized information via basic IT. Information within these documents cannot be electronically manipulated. Level 3 is machine organized data. This is transmission of structuredized messages containing non-standard data. This requires interfaces that can translate incoming data from the sending organization's vocabulary to the receiving organization's vocabulary. And Level 4, the highest level, is machine interpretable data. This is transmission of structured messages containing standardized and coded data. This is the ideal state in which all systems exchange information using the same format and vocabularies. Projections of cost for nationwide adoption. Interface defined. An interface is a program that enables different systems to communicate with one another. Level 3's interface cost would be $50,000 per interface, per hospital, per lab, per radiology department, per pharmacy. Level 4 requires one internal interface for every external interface. It is estimated that between 8 and 20 interfaces will be needed. This is all dependent upon the size of the organizations and the departments within the organization. Additionally, 17.5% of the initial cost was added to cover ongoing licenses, fees, system upgrades, and hardware replacement costs. For physician group practices, it would cost $20,000 per interface. Additionally, the study allocated the cost equally over a 10-year period. The results of the study, some financial benefits that were realized for inpatient, was reducing redundant testing, delays, and costs associated with paper-based ordering and reporting, would produce a national annual benefit of $8.09 billion at Level 2, $18.8 billion at Level 3, and $31.8 billion at Level 4. Some financial benefits for outpatient. Interoperability would reduce medication-related calls for both clinicians and pharmacists, saving over $2.19 billion at Level 2, $2.66 billion at Level 3, and $2.71 billion at Level 4 on an annual basis. Nationwide, providers at Level 4 will benefit an estimated $33.7 billion per year after taking all of the cost savings, which was $44.22 billion, and subtracting the expenses, which was $10.5 billion. Some more results, quality benefits. Patient-provider connectivity would save time associated with handling chart requests and referrals. This would reduce the amount of redundant testing. Additionally, it would ensure all historical information is present to assist with patient care decisions. Some public health benefits. Reporting of vital statistics in certain diseases would be more efficient and complete. It would save $195 million at Level 4 each year. So it also allow public health organizations to track and see trends for disease outbreaks, and biosurveillance becomes possible to easier identify warning signs from aggregating data. Elements that are needed to be put in place for nationwide adoption. There needs to be policy incentives, federal leadership, state and legislative mandates, and there needs to be changes in reimbursement. Summary. Adoption of Level 4 interoperability has the potential to address at least two aspects of the Iron Triangle, which consists of cost, quality, and access. According to the article, there are 4 levels of interoperability, and the higher the level achieved, the more cost saving the organization will realize. Although this article talked about the benefits interoperability brings about, don't forget about the barriers that exist when implementing new technology: the financial barriers, the compatibility barriers, and the attitude barriers. The reference I use is listed below. If you have any questions or comments, please post on the forum and I will get back to you as soon as possible. Thank you for watching.